Hello, good morning, Dr. Chua. My name is Faezah binti Majais. I'm a master student. Today, I'm going to run through the practical test for question 1 or station 1. So for this patient, it's a 55 years old female college lecturer experiencing of having chronic neck pain and also shoulder pain on the left hand side with numbness in the left arm and also hand. Her symptom appeared 2 years ago, and however she's not been referred to physiotherapy. So for this patient, the subjective assessment that I'm going to look into is I will ask for where is the place of or site of pain she feels, okay, and what are the aggravating factors. For example, is the pain only appears during resting only, or it also feels when she moves the neck or the shoulder or the arms, and what are the intensity that I can also use the numeric pain scale to know from 1 to 10 to look into the severity of pain. Okay, if patient, this is 55 years old patient, probably if she cannot recall, I can also use visual analog skills with the face expression to make sure that I gain depth inside of her pain feeling. Okay, and the nature of pain, she already complaining of having numbness and probably some other pain, type of pain, different type of pain. Okay, and then I also probably want to do also medical history, taking some medical history of the patient, probably because this is 55 years old. We wanted to know whether any underlying medical illness that may contribute, for example, diabetic patient, hypertension, and to know, this is very important to exclude the red flag for this particular patient, and some social history which may have, we wanted to know the nature of work, the lifestyle, okay, and of the patient and the activities that she normally do, that functional activity that normally contributed to the pain. Okay, so for this patient, because she is complaining of having pain, numbness, I will choose to have to do, we call it dual neuropathic 4 DN4 questionnaire, which is to estimate the probability of neuropathic pain. That patient will have to answer yes or no for the items. There is 10 items, okay, related to pain quality. So what patient have to answer is for the question 1, okay, this is going to be an interview for question 1 and question 2. Question 1, interview, does the pain have one or more of the following characteristic, which is burning, pain cold, okay, or electric shock? That patient will have to answer yes or no. Okay, question 2, is the pain associated with one or more of the following symptom in the same area? For example, tingling, pain and needles, numbness and itching. Same, patient will have to answer yes or no. And in terms of the examination, question 3, is the patient, this is going to be an examination where we will have to do the hypothesia to touch, whether the patient is feeling, there is patient to have to answer yes or no, and also hypothesia to pinprick sensation, yes or no. And question 4, we will, in the painful area where she's been complaining of the left arm and hand, can pain cause increase by brushing? If you can actually do the brushing, then patient will have to answer yes or no. They will be like, out of 10, yes 1 point, no 0, then it is accumulated to 10. This will show you the severity of how much the patient is feeling pain. Okay, and this is the pain DN4, okay, and also pain numeric scale of VAS. I have to use it every time she comes for session to know, to see on the improvement after I do the treatment later. Okay, for the objective assessment, there's a few things that I'm going to test, is active and passive range of motion of the neck, okay, at all movement, all right, and also the shoulder movement, not to be forgotten. And I will do the palpation, okay, whether there is pain area at the which region of the cervical region. Okay, and also probably I will have to palpate along the shoulder area, for example upper trapezius, because patient been complaining of having numbness. It could be to exclude whether there is any influence with the spasm of the muscle, for example. And I will do reflexes because patient is complaining of having numbness for biceps tendon and also tricep tendon, and we range it from 0 to 5 to see, and we have to compare between right and also left. And then for this the next one, what I will do for this patient is I'm going to test for the sensation test because we already done it during using the DN4, that it is a must because patient is complaining of having numbness. And also I will also do muscle strength test, okay, for C5 C5 C6, okay. So for shoulder abduction, I will test the resistance, okay, abduction, and then adduction C5 C6, and then I'm going to test the elbow flexion C5 C6, and then elbow extension resisted C7 for C7, and then I'm going to do for wrist extension C6, and then flexion C6 C7, and also T1. Okay, going to test resistance for the T1, and also thumb for C8 and T1. I have to compare right and left for this patient so that I can know that whether there is muscular weakness due to from the pain of the patient. So the next one, I will do some specific tests. Okay, upper limb tension test for this patient because she's complaining of having numbness. To do that, I will put patient in supine position. I will have to support at the shoulder area, and then I will have to ask the patient to do, and then try to do the tension test. Okay, this is to see whether any increasing in complaint of pain or radiating, or this is to provoke the pain. Normally we have to do gradually. For example, what I mean is we have to do, if patient, because this is first time, if patient comes to you first time, we don't want to cause more pain to the patient, so we have to ask the patient to put this position. Some patient will already complaining of having pain, then we will not proceed with the next step. Okay, so we will do it gradually. If patient can, then only we will combine with hand and also with neck movement, okay, to see any, this is to provoke to see any increase in the pain sensation, okay, and tension. Okay, the next one I will do is spelling test, okay, where I can be standing behind the patient, ask patient to extend the neck, and then alright, and then side bending neck, okay, to left, and then I will see whether any patient is complaining any increase in pain to provoke. If no, then only I can put some pressure to do some provocation. If no, then only if patient is already complaining of pain when doing the neck extension, we will not proceed further for this patient. Okay, this subjective and also objective assessment need to be done, and we'll see the correlation between subjective complaining on pain and also objective, for us to be able to have a better plan for this treatment of treatment of the patient, to see whether what kind of complaining, and probably to see on any other thing, that red flag, for example red flag, is it ada red flag, yellow flag, or a different kind of flag, so that we can actually do some better intervention to help this patient is the problem. Thank you very much.